Hi, everyone, and welcome to another episode of Health Matters, the Worcester District Medical Society's cable access medical information show. It's covered on WCCA TV, which is channel 194 on your cable dial. And I'm Dr. Michael Hirsh. I'm here with a very pleasant task of interviewing two wonderful UMass medical students who have set up a program in the city which I think is going to have a tremendous impact in helping to reduce some of the alarming health disparities that we have been discovering across the spectrum of medical illness in this country. So my guests are first to my far right is Rebecca Ukaegbu, sorry, and also Maureen Ogamba Alfonso, who are medical students who have a unique quality of being members of the Gold Humanism in Medicine Society and the National Student Medical Association, which are two different kind of medical societies, which I will have them explain to you, that came together with a proposal to revive the Barbershop Health Network. And I'll stop there and just ask you guys to say, how did this all come together? I will say that your presentation to the Worcester District Medical Society was so compelling that we were able to find some dollars to help revive the program, and I think it's going to be something that we're going to be affiliated with for a long time. So thank you for your advocacy, and we'd like to hear how this is going to work in Worcester and what you think it's going to do.
Thank you for having us, Dr. Hirsh.
Sure.
Thank you for having us.
Oh, my pleasure.
We want to start with talking about the health fair that we had, which was on Saturday, April 27th. It was held at the Central Community Branch, YMCA, where Rebecca and I both organized and led the health fair. We're both members, as you mentioned, of the Gold Honors Human Society and also the Student National Medical Association. The health fair was a large collaboration between both of the student organizations we're involved in, also Worcester District Medical Society and Barbershop Health Network. During the health fair, we screened for multiple diseases such as hypertension, diabetes, visual acuity. We also checked for carbon monoxide levels and also mental health screening. We also had several education sessions for the people who came to the health fair. And you can talk more about the education that we had.
We did a couple different education sessions. We had a sort of table on prostate cancer. We talked about gun violence. We talked about breast cancer. We also did sort of some screening on dental health and also sexual health as well. So participants were able to sort of take advantage of all of these, both educational and screening opportunities that were available. It was a long day, but I think we were incredibly happy to see people in the community who came and were sort of willing to participate in the fair. And then we also sort of learned a lot ourselves from putting it on.
Yeah, I mean, as a participant for at least part of the day, I was really impressed by the energy level and the enthusiasm, not only on the part of the volunteers that had come, physicians and medical students, and some dental students from MCPHS and other kind of volunteer groups, but also the fact that the people that we were screening were so grateful and so enthused about this kind of an event, because I mean, and I'd love you to discuss this more. The conventional medical setting is a little off-putting. It's off-putting, I think, because it involves long waits and appointments and insurance and all this other stuff, but it's not necessarily getting the health and wellness promotion information transmitted like you guys were doing. So just wonderful to see that happen. What do you think is different? I mean, why the barbershop, and why well, this was not in the barber shop, but we used the same kind of resources because we knew that at this basketball tournament that the YMCA was putting on, that a lot of the same participants that might have come to the barber shop would be there, so we took advantage of their presence there. But why would that be so comforting?
One of our goals was to really try to reach, I guess, patients who may not turn up at their doctor's office for their annual checkup. And when we were discussing how exactly to organize the health fair, whether we wanted to go back to the barbershops or whether we wanted to do a larger health fair, when we were still in the planning stages, one of the things that was really important to us was to figure out how we could draw sort of the population that we were really interested in. And the key population that we were going for were particularly men of color who sort of don't always have the best sort of health habits sometimes in terms of going for that annual checkup, making sure that they're getting things like their blood pressure and their blood sugar checked often, and especially those in the older population. And so when we were thinking about this, we were, okay, how can we create an atmosphere that is going to be the most conducive for that population, for us to be able to reach that population? And that was why partnering with the Central Community Branch YMCA was so important, because this is, a great community center that a lot of sort of the patients sort of go to on a regular basis. And so in that partnership, the other thing that came up was, how do we make the day itself, the health fair itself, sort of the most conducive of what we were trying to achieve. And so something that we really thought was important was to create as low key an atmosphere as possible, so that when someone walked through the door, they felt super comfortable. There was nothing intimidating. And one of the things that we did was to sort of ban white coats. And the volunteers were allowed to wear white coats. Everyone was just supposed to show up in sort of their regular street clothes, just sort of help create that atmosphere. And then also just sort of engaging with the people who walk through the door, talking to them, finding out a little bit about them. If they don't see their physician often or don't have a PCP, why aren't they doing that?
Yeah, I mean, I think it was very, very, very warm and non-threatening, which was great. I was wondering if we have some photos from the event, and I wondered if you might just comment, like, what do you think they illustrate? I have to say, I put myself in a couple of these photos, but it wasn't about me. It was just that I didn't want to get patients because I didn't have permission to film them, and so I didn't want to go through that process. But Frank is showing, this is, here, you guys are the rock stars here. But here's an unidentified patient at one of the stations. What station is this? Do you remember?
So this was the very beginning, right? When you walk in, we had a great sort of welcoming team who was there to help orient sort of the people who are attending the fair, and let them know what was going on, let them know what screenings we had available, and to sort of help them walk through the whole fair.
Oh, that's great. And Frank, you want to show us the next one? Thank you. Oh, and this is the team,
This
right?
is the team.
This is the welcome team.
Yeah.
Great.
Look at their smiles.
And that's a great title, Doc in the Shop. Different than the old barbershop health network kind of thing that we were doing. This sounds a little bit more like, it was something you do on a Saturday. See the doc. Great. So this was our team photo, right?
Yeah.
These are some great members of the team. There are some physicians who were there. There are some of our partners from the YMCA and from the Barbershop Health Network, and some student volunteers in there as well.
Also, City Councilman Christian King in the front row next to Maureen, which was great that he showed up, and Brenda Davis is the young woman all the way on the right side of the screen, who is the community relations director for the Y, and she's been very involved with the Barbershop Health Network, even if in its previous iteration here in Worcester, and is just a terrific advocate for health in the community. I want to say a little bit more. So the melding of the gold and the National Student Medical Association is a really great potential partnership, which I hope really stays. Now, you guys are in both.
Yeah.
And tell us a little bit about what each of them is supposed to do and why you think this is such a good marriage.
Well, the Gold Honor Human Society is a society that you're volunteered for, chosen by your peers during your 4th year of medical school. And so we were both chosen by our peers to be part of this organization or the society. And mainly, we're chosen mainly because we have some humanistic values that our peers saw in us. And I think that one of the things that they saw in both of us is our passion for our community, our passion for giving back, our passion for addressing health disparity, and especially helping the disadvantaged populations and the underserved population.
And the National Student Medical Association?
Yeah, so the Student National Medical Association is sort of the organization in medicine that serves sort of underrepresented students in medicine. And some of the goals of the organization is to increase the number of sort of people from that population who are matriculating into medicine, and then also just to push for the education of clinically excellent and socially conscious physicians throughout sort of the medical education system.
That's great. And Maureen and Rebecca are being very humble. It's a small group of people that get elected into the Gold Humanism Society, and because we're very fortunate at UMass that so many of our students are very humanistic and have demonstrated tremendous community service. We have a tough job. I'm on the selection committee. We have a very tough job in helping pick the ones that are outstanding enough to be in the gold. And for you guys to have gotten the gold is really a wonderful tribute to the terrific work you did even before this project. So
Thank you.
Thank you.
it's really it's a pleasure having students like you around. So I think Frank just flashed another picture which I didn't discuss, but the medical student who is our camera expert who took most of these pictures is here, and I want to at least acknowledge.
Yes, that's Ogo. She's I think in her 5th or 6th year MD PhD student.
Yeah.
I see. Yeah. And that little baby?
Oh, that is Asia's baby.
Asia's
Yeah.
baby.
Yeah.
Yeah.
And
So Asia's another MD PhD student who's going into urology.
Yes.
And
It was
she's-
great to see her. She
Yeah.
just sort of she wanted to come and support the fair, so she just sort of brought her baby
Also, her
along.
husband was one of the physicians who was helping screen and during the sexual health education, and so that's their baby.
No, that's great.
Dr. Anabanjo.
And you can see we're all wearing T-shirts. It's kind of a nice, easy color. Oh, this you don't have to show. Rebecca looks great. But I wanted to at least show. I had a little. If you go on the next one, Frank, I think. Yeah, I just wanted to point out that I had a little gun safety session with several of the folks that came through. I'm wearing today an orange tie because when this program airs next week, June 7th, 8th, and 9th is National Wear Orange Weekend. And it's about, orange is the color where hunters put this on so that they don't accidentally get shot. So this is the color of the Moms Demand Action Group, the Brady group, and there's one other, the Massachusetts Coalition to Prevent Gun Violence. So it's a little premature that I'm wearing orange, but I want to remind our viewers that gun safety is a huge issue for us. There are health disparities in that because in the homicide group, it's 15 times more likely that an African American male will get murdered than a Caucasian male. And that's kind of what I was concentrating on when I was talking to people, is that I think an unsecured weapon in the home is a tremendous danger to the gun owner, not to the person who's going to try to break into the house. It's more that suicide, homicide, femicide, all comes from unsecured weapons. So I thank you for giving me a little bully pulpit there to do that. So I guess what I would say also is in the course of medical school, and Maureen is about to graduate this coming Sunday, June 2nd. She'll be graduating and off to Danbury for an OBGYN residency, which is wonderful. How do you feel the medical system and our med school in particular dealt with health disparities? Do you feel that you had enough education about it? Do you feel that a graduate, perhaps without all of the extra sensitivity about it that you have, will be cognizant of the problem and maybe more attentive to the need to do better about it?
I believe UMass is making an effort in teaching us about health disparities. There's more work to be done, obviously. During our time at UMass, we had some sessions on talking about implicit bias. We had some guest speakers come in to talk about bias in the medical field and also health disparities in the medical field and how that can transcend down into the health. We've also had several seminars that were required for us to attend. And within lectures that we've done in class, especially learning about biostatistics, there was always a mention about which groups were more affected by certain diseases, which is why we know now that diabetes and hypertension and obesity is a lot more prevalent in the Black and Hispanic communities.
Yeah, and to add to that, I think, like she said, UMass does sort of do an okay job, I think, in sort of introducing the topic. But I think this is an issue that sort of across the board in medical education needs to be sort of tackled a little bit better. I think at the start of start of med school, especially in the first year, I think we got a lot of like targeted education on it. But I didn't necessarily see it follow up more once we got into the clinical setting, so in our third and fourth years. So I think there's an opportunity to sort of inject that more into that part of our education. I think it's very important in that stage too, because sort of in the first 2 years, we're knee deep in the books, learning the science, learning all of that. And then once we cross over to the clinical sort of part of the education, that's where we can start to apply the things that we've learned. And I think because that sort of social determinants isn't as big of a focus there, there's a sort of missed opportunity for us to really see with our own eyes sort of how that comes into play when we see patients. For example, when you see a patient who might have asthma, for example, and you're not necessarily considering all of the things that could be impacting sort of that disease, whether it's because of where they live, sort of the access that they have to sort of exercise and outdoors and all of that. So I think there is an opportunity to include that more, but I don't necessarily think that that's an issue with just our medical education. I think that's a more systemic problem.
Now you decided to take the track of mental health in your future. So where do you see potential for improvement there in disparities?
I think sort of this is speaking for myself and sort of what I know, especially in my own community. I'm Nigerian American, and sort of in the immigrant population, I would say there's a lot of taboo surrounding mental health. I think a lot of immigrant families see sort of mental health as an issue with someone's character and not necessarily as an illness. So I think that there's a lot of opportunities to sort of try to break down sort of that taboo and to get people who are really suffering in that population access to the care that they need. And I think that also sort of translates to sort of the Black American population as well. I think there's still a lot of stigma to sort of like mental health illnesses that make people sort of shy away from sort of seeking the help that they need. So I think sort of trying to bring that to the forefront and normalizing mental health as, it's something that everyone really has to deal with their mental health. It's not just someone who might be sick. You and I sort of have to take care of our mental health too. So I think normalizing it as something that everyone sort of deals with and should deal with will hopefully help with that.
Even the terminology mental health can be a stigma, which is why during the health fair we call that station mental wellness, to kind of take away from the stigma and make it more approachable for people to talk about the issues that they have.
So, taking that to the next step, I think about 60 folks were screened on your health fair day.
Yeah,
More than 90.
Yeah, I think
90?
almost 100.
Fantastic.
Yeah.
We were able to kind of figure out a group of docs that would plug them into potential appointments if they needed, and I'm saying we, you as well as the Worcester District Medical Society came up with a list of docs who were very kind about putting out their panel and letting us infuse people that we clearly identified at the barbershop health event that needed further follow-up, and we were worried that if they delayed, weeks and weeks and weeks, that they would lose the momentum of finally facing, I have a problem with my blood pressure, I have a problem with too much smoking or whatever. So I think that was great. So where do you see the network or the doc in the shop going over the next 2-3 years? I know that you're hoping that the next group of gold students and the next group of the Student National Medical Association students will carry the flag once you guys have moved on. You have another year here. What is your vision for that?
So right now we're kind of in the process of debriefing and seeing what we can learn from the health fair that we just did about a month and a half ago. We're sort of going back to the table, seeing what we learned, because while the health fair was sort of successful, I think there are still lots of opportunities for improvement, and we want to do that work first before we sort of go into sort of the next stage. But sort of alluding to some of what you said, I think some of the things that we see doing next is sort of taking the bigger health fair and figuring out how we can do smaller iterations of it in different settings, whether that's sort of going to the barbershops or expanding it to not just be focused on men of color, but also women of color, because that population also deals with its own sort of health issues and disparities as well. So taking it into sort of beauty salons, for example, and doing some work there, and then also exploring ways that we can better reach sort of the target audience that we're trying to get. So we will be looking into various events that are happening locally in Worcester, and trying to have a presence at those events, whether it's sort of a community-wide fair that's happening in the center of town, whatever it is. We're really open to figuring out ways to really reach and have as much impact as possible.
Yeah, one of the amazing things that we've learned from the health fair is we had a lot of positive feedback, both from the physicians and also the participants. Many physicians that volunteered mentioned that they wanted to continue being involved and wanted to expand their role. And also, we had some participants who suggested that we kind of create the similar health fair at certain Worcester community events that are coming up. So that made us realize that people are receiving the health fair well. They want to learn more. They want more of our presence, and they want more of the education and the screening. So going forward, our goal initially when we started, when we wanted to jumpstart this health fair, was to be able to continue it, expand it, have it be a legacy for UMass students in a project, and continue to reach out to the target populations, which are Black and Hispanic populations, among other minorities.
So I can tell you from the standpoint of the Worcester District Medical Society, I'm currently chairing the Public Health Committee. There was really a lot of enthusiasm about reviving this program, and I think we couldn't have envisioned a better restart than the one you guys accomplished. You really did it in a seamless way, and I think the fact that you got so many volunteers and so many participants is really terrific. We didn't really have like big media blitzes and things like that.
Yeah.
It was all kind of word of mouth, and
Yeah.
so you know, just totally kudos for you guys for
Thank you.
for getting
Thank
it together. You know.
Thank you.
I think this is the kind of community involvement that we crave in the community of Worcester. We're coming up with a new community health improvement plan process, which will begin in 2020. And so I think that we really would love to see involvement from some representative of the doc in the shop in that process, so we can really make sure we're not leaving anyone behind in this, you know?
Yep.
So we just have a couple of minutes left. Any last thoughts for the audience if they want to be involved, or if how would they stay in touch with the progress of the doc in the shop program?
I think there's a lot of ways for us to get involved. So we had student volunteers, we had physician volunteers, we had some community volunteers. We also had a lot of sort of interpreters, people who were helping with interpreting for Spanish and Vietnamese, just to sort of help reach sort of the population that we were sort of targeting. So there's a lot of different ways that someone who is interested in the healthcare could get involved. I think if you are looking to sort of do that, a good place I think to start would be at the YMCA, sort of going there and sort of contacting the contacts we have there, Brenda and Matthew Evans, and then also just reaching out to us via the medical school as well.
Yeah, so feel free to reach out to us. Rebecca's staying for another year, and she forgot to mention that she's taking this on as her capstone project. So
great.
she'll be a good person to contact.
Well, I want to thank both of you, and I wish Maureen terrific luck in her new pursuits, and congratulations on your marriage.
Thank you.
And Rebecca, thank you for hanging in another year with us, and hopefully we'll revisit this at some point. So we're saying goodnight from the Worcester District Medical Society's Health Matters program. Again, you can watch this program on channel 194 on your cable access. You also can see this on our website in a couple of weeks, wdms.org, www.wdms.org. This is Mike Hirsh, and I will be signing off and looking forward to talking to you the next time we find something that is intriguing and matters.